This issue is fundamental to all of us, and it's one that can't be addressed in and of itself in a vacuum. And so with that, we have a couple of announcements here on the next commissioner. The first one is the Minnesota Department of Health. And again, we've spoken about this constantly. Health is a basic human right, plain and simple. We've made progress in Minnesota, making sure we can have healthcare, public health, and of course, making sure that no matter where or who you are, that we have gaps, that there are racial gaps in terms of outcomes, of health outcomes, and there are gaps in where your zip code is on whether you're going to get better care or live longer. So that's why today I'm glad to announce Commissioner Jan Malcolm will continue in her role as Commissioner of the Department of Health. Commissioner Malcolm came to MDH in early 2018 to stabilize the agency. The continuity of this agency is important to us, and that's why we've asked her to stay on. Her expertise in public health and healthcare policy is critical in helping us build a One Minnesota and restoring trust, especially as it deals with the care of our long-term care facility and nursing homes. And I just have to take a moment to say, some of you have seen a theme among me of the people that have my ear, if you will, who I trust to listen to very deeply, are mayors and county commissioners in a lot of cases. Those folks are at the ground, and when it comes to health and health delivery, human services delivery, those county commissioners are absolutely critical in this. And I can tell you that Jan Malcolm's name came up as someone who absolutely has the trust of those county commissioners, of someone who knows how to deliver it. And these were folks that were called unsolicited and said, if you want to make a really good choice, make sure you keep Jan Malcolm in there in this agency. And it's with that she has agreed to stay on to help us transition and get this right in that agency. She certainly believes in putting people above politics. That's why she's going to continue on as our commissioner. And with that, I introduce to you Jan Malcolm. Thank you.
Good afternoon, and thank you so much to the Governor-elect and Lieutenant Governor-elect for this honor and this opportunity to continue to serve Minnesota as Health Commissioner. As the Governor-elect just alluded to, the Minnesota Department of Health is the centerpiece of our state's public health system, along with our local public health agencies, healthcare providers, and so many other community partners all across this state. This is a health system in Minnesota widely regarded as being among the best in our nation, even as we grapple with an evolving set of challenges. I've spent my entire career in health policy, healthcare finance, healthcare delivery, and public health leadership. And this is where my heart lies. I am deeply dedicated not just to understanding the complexity of our system, and it is complex, but the real measure at the end of the day is how much health are we producing for our state, for our citizens, for our neighbors, for all of us, and not just resting on our laurels as a historically healthy state, but dealing with those health inequities that the Governor-elect has just mentioned. One of the things that really excites me and humbles me about this challenge is the enormous breadth of the responsibilities of the Minnesota Department of Health and our public health partners. We literally touch everyone in this state every day, usually in ways that are quite invisible to the public. But the ways in which we can influence health and build health in our state are a remarkable asset. We monitor for and respond to a very wide range of disease outbreaks and environmental health risks. We study patterns of health risks and illnesses and inform Minnesotans about the protective actions we can all take to improve our own health. We study the healthcare system itself, the economics and policies of health insurance and healthcare delivery. How does it work? What results is it producing? Where are the opportunities to improve health and reduce costs? That's where we need to focus. We promote active and healthy living, working across sectors with business, labor, education, the faith community, and healthcare, and with communities all across this state to make it easier to eat healthy, be active, have opportunities, quit commercial tobacco, and really seize the opportunities that we have to build a healthier One Minnesota. As we do this work, our constant theme is to look upstream to prevention, to ask what are the conditions that make individuals, families, and whole communities healthy, and how can we work together to better create those conditions in an equitable way for all Minnesotans. And though we often don't think about them, we in fact in Minnesota face a wide and sobering range of public health challenges. Some of them are old and familiar. We may think we have left them behind, but it's not the case. Like infectious diseases and the importance of keeping up our protections through high vaccination rates that reach all communities, not just some. Those familiar challenges also include tobacco and nicotine addiction, which are seeing a very concerning rise just recently, driven by e-cigarette use and vaping, especially among our kids. There's also the ongoing challenges of obesity and the chronic diseases that emanate from it. Some of these challenges have been present for years, and others have been also with us for years, but are just now really reaching the public consciousness, reaching epidemic levels of concern, especially in communities experiencing severe health disparities. These would include things like opioid use disorders and opioid addiction, alcohol use, and suicide in communities across our state. We also need to attend to the prevention and to respond to incidents of elder and vulnerable adult abuse and neglect, as the governor-elect mentioned. I'm particularly glad to have the opportunity to continue building on the good work of the department and our partners over the last year to improve our regulatory processes, which definitely needed to happen, but also to broaden the policy discussion about how we modernize the laws and the protections that exist for vulnerable adults. We face new awareness and greater understanding of environmental challenges. Several of us here are speaking about the importance of the environment to our economy, to our very fabric, and to our health. The more we know about the science, the clearer it is to us that there remain environmental health risks that need to be mitigated in our water, our air, and our land. We also face global health challenges from which we are not immune. Things like antibiotic resistance and climate change. It's a sobering list of issues to address, but the good news is we have all the tools we need to come at this in a holistic way, working across silos, as the governor-elect has said, to partner with all of those sectors in our communities that actually create those conditions that produce health. We all have a role to play in ensuring that all Minnesotans achieve full health, whether that is closing gaps in health insurance and access to care, and most importantly, to close those gaps in health outcomes. I so appreciate the opportunity to continue this work about which I'm so passionate and to work with this wonderful team. I look forward to this day making even bigger steps forward in the future through the leadership of the Walz-Flanagan team. Thank you so much.